Hi, my name is Iman from the Immigrant Resource Center of Maine. Instead of monthly trainings, we will switch to weekly community education videos as part of a new monthly topical series. We're continuing to focus on sexual assault awareness in Maine as part of April's Sexual Assault Awareness Month. Our focus this week is on explaining female genital mutilation's impact on immigrant and refugee members in and out of our LA community. Female genital mutilation, also known as female genital excision or female genital cutting, is a set of procedures involving partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. There are different types of FGM procedures that affect different aspects of the female anatomy. Here are the following harmful procedures. The first procedure is a clitoridectomy. A clitoridectomy is a partial or total removal of the clitoris. In very rare cases, only the prepuce, which is also known as a fold of skin surrounding the clitoris. The second procedure is an excision. An excision is a partial or total removal of the clitoris, the labia minora, with or without excision of the labia majora. The third procedure is an infibulation. Infibulation is a narrowing of the vaginal opening through the creation of a covering seal. The seal is formed by cutting and repositioning the inner or outer labia with or without the removal of the clitoris. Other procedures include all other types of procedures to the female genitalia for non-medical purposes, also known as pricking, piercing, incising, scraping, cauterizing the genital area. Harmful practice has a severe effect on women and girls' sexual and reproductive health, both in the short term and long term. Some of the immediate complications are severe pain, wound or urinary infection, fever, hemorrhage, and even death. Long-term issues include anemia, keloid scarring, urethra damage, increased risk of getting HIV, genital hypersensitivity, painful sexual intercourse, and other physical and psychological effects. The psychological impact of FGM includes the following: anxiety, depression, PTSD, early childhood trauma, sexual dysfunction, and other issues that may appear over time. Infibulation, or the narrowing of the vaginal opening, obstructs menstruation as well as establishes a physical barrier, making sexual intercourse and childbirth difficult. In order for FGM victims to have children or sexual intercourse, they must be cut open. Labor is especially difficult for these victims as it leads to a much greater risk of postpartum hemorrhaging, prolonged hospital stays, and also infibulation can lead to recurring UTIs, infertility, urination, and menstrual disorders, as well as other physical ailments. FGM is traditionally carried out by community elders, mostly women or birth attendants. Even though women make up a majority of those who perform, certain communities allow for male health practitioners, herbalists, and other community members to also practice the procedure. Certain communities have also medicalized FGM, allowing for medical professionals to perform the practice. In countries where FGM is practiced, at least 25% to almost 75% of FGM victims were cut by a trained healthcare provider. There are social pressures and established cultural practices in which FGM is considered the norm and an expectation. FGM is viewed as a coming-of-age ritual for young girls and women as one of many community traditions that need to be upheld. These rituals promote false ideas like FGM may help with fertility and an unborn child's health. There is also misheld beliefs that it ensures a woman's fidelity and virginity prior to marriage. Parents who support the practice may believe they're protecting their daughter's future marriage prospects by getting the procedure done. This is why many communities that practice FGM believe it's a precondition for marriage. In certain communities that practice FGM, external female genitalia may be viewed as dirty or unappealing, or then removed to promote their idea of hygiene and good appearance. FGM is often regarded as a foreign practice rarely done in the United States. However, FGM was considered a medical procedure for the quote-unquote treatment of perceived female promiscuity and other female sexual health issues back in the 19th and 20th centuries in the United States. These practices continued well into the 1970s. It wouldn't be until 1996 that the federal government would pass the Female Genital Mutilation Act. In 2013, another act was passed to ban vacation cutting, performing FGM abroad, and then bringing young victims back to the United States. While FGM is illegal on a federal level, it's up to the state whether or not to prosecute the crime. The FGM Act also made it a point to begin doing outreach and education to communities that practice FGM. The Immigrant Resource Center of Maine does its part to spread awareness and educate different communities on why FGM is a harmful practice. We reach out to community leaders and members to discuss FGM and to answer and clarify any questions or concerns they may have. For instance, there may be community members who still view the practice as being cultural and/or religious. Our goal is to dispel these myths so new Mainers may understand a new perspective. We do outreach and education by heading to cultural religious spaces like mosques and cultural centers to make new community members feel comfortable enough for an open discussion on the issue. Through our education support, FGM hasn't been practiced in our community since our work has begun. We make sure of this by not only educating community members, but also through our work with police officers and other officials about how to address FGM. It's important to recognize FGM as a form of sexual assault and violence because it's a major global issue that affects millions of women around the world and here, even in Maine. Fortunately, we've managed to eliminate the practice within our Maine community through education and awareness. We hope you felt informed after watching this video. Thank you.